Many people ask an important questions. What causes heart disease? Heart disease usually does not happen overnight. It often develops slowly over many years. Understanding the causes can help people take steps to protect their heart. Today, I want to talk about the most common causes of heart disease. These are often called risk factors. Risk factors are things that increase the chances of developing heart problem. Some risk factors cannot be changed. Others can be managed with care and support. One risk factor that cannot be changed is age. As people get older, the risk of heart disease increases. This happens because blood vessels and the heart change over time. Family history is another risk factor that cannot be changed. If close family members have had heart disease, the risk may be higher. This does not mean heart disease is guaranteed. It means being aware and proactive is important. Now let's talk about risk factors that can be managed. High blood pressure is one of the most common causes of heart disease. Blood pressure is the force of blood pushing against the walls of the arteries. When this pressure stays high for a long time, it can damage blood vessels and the heart. High blood pressure often has no symptoms. Many people do not know they have it. Regular checkups are important because treatment can lower risk. High cholesterol is another major risk factor. Cholesterol is a type of fat in the blood. Too much unhealthy cholesterol can build up in the arteries. Over time, this buildup can narrow the arteries. This makes it harder for blood to flow to the heart. This can lead to chest pain or heart attacks. Diabetes is also closely linked to heart disease. High blood sugar can damage blood vessels and nerves that controls the heart. People with diabetes have higher risk of heart disease, especially if blood sugar is not well managed. Smoking is a strong risk factor for heart disease. Smoking damages blood vessels and reduces oxygen in the blood. It also raises blood pressure and increases the risk of blood clots. The good news is that quitting smoking can improve heart health at any age. It is never too late to see benefits. Lack of physical activity can also increase the heart disease risk. The heart is a muscle, like other muscles. It stays stronger with regular movement. Being inactive can lead to weight gain, high blood pressure, and high cholesterol. Even light activities such as walking can support heart health. Unhealthy eating habit can affect the heart over time. Diets high in salt, sugar, unhealthy fats, and processed food can raise heart disease risk. Eating more fruits, vegetables, whole grains, lean protein, and healthy fats can support the heart. Small changes can add up over time. Stress is another factor that affects heart health. Long-term stress can raise blood pressure and heart rate. It can also lead to unhealthy coping habits, such as overeating or smoking. Learning healthy ways to manage stress can benefit both the heart and overall well-being. Poor sleep can also affect heart health. Not getting enough sleep or having ongoing sleep problem can raise blood pressure and increase inflammation in the body. Good sleep supports the heart, brain, and immune system. Weight can also play a role. Carrying extra weight can make the heart work harder. It can also increase the risk of high blood pressure, diabetes, and high cholesterol. It is important to approach weight with kindness and support. Health is not about perfection. It is about progress and balance. It is also important to understand that risk factors often work together. For example, someone may have high blood pressure and diabetes at the same time. Managing one risk factor can help improve others. Heart disease is complex. There is usually no single cause, but understanding these factors gives people more control over their health. The most important message is this: having risk factors does not mean heart disease is unavoidable. Many people reduce their risk through medical care, healthy habits, and support. Talking with a healthcare provider is an important step. They can help assess personal risk and recommend appropriate care. Learning about heart disease is empowering. Knowledge helps people make informed choices and feel more confident about their health. Thank you for spending this time with me.